I don't really care very much about the royal birth. I was over in Europe last week, and while I was there, the royal birth happened, and it was magical and incredible and completely over the top, and people loved it, all that stuff. I don't really care about the royal birth. I am interested in taking the royal birth and using it to talk about the healthcare system in the US. The royal birth cost $15,000 roughly. And that figure comes from estimates of how much one would have to pay to give birth in the Lindo wing of St. Mary's Hospital. That's where the Duchess of Cambridge gave birth to her son. This is pretty expensive in the United Kingdom, Lewis. Even by their standards, this is quite expensive. But in the US, $15,000 to give birth would actually be considered really a pretty good deal. The average total price charged for pregnancy and newborn care was about $30,000 for a vaginal delivery and $50,000 for a C-section. Now, bear in mind that that's the billing, and as we know, because of the healthcare system in the US, what's paid is often not what is billed. The actual payouts were somewhere between $18,000 and $28,000. Still a significant difference there. And what's driving these healthcare costs, one of the big differences is that in the UK, you basically pay for the entire thing. You're not getting this itemized list where the more stuff that is done to you, the more medications that are put into you, you get this line by line billing where the cost adds up. And the way hospitals make more is by doing more stuff, which, as we know, doesn't lead to preventive care. It doesn't lead to better outcomes. It just doesn't really work. And I think that this is a brilliant opportunity, Lewis, to really outline and point fingers at some of the huge problems which we've always been talking about for years on this show with the American healthcare system.
Yeah, it's a disaster. This is one example, and I'm sure you could point to just about every form of care and find huge differences like this when comparing us to countries with what I would call more civilized healthcare.
Absolutely. And so if you take nothing else, if you don't care about the royal baby's name, if you don't really care about how many people need to die for the royal baby to become the king or whatever the case may be, think about the healthcare system. That is the best conversation that this royal birth could cause us to have.